Aloha, I'm Dr. Jill Hogard Green, and I have the privilege of being the CEO at Queen's Health System. And I'm here to talk about something that's really important to our health and our safety in our community, and that's vaccinations for COVID-19. We've done an amazing job as a community, all leaning in this devastating pandemic. We have had excellent leaders in our government. We've had excellent leaders in our businesses. You and your family have done tremendous work to make sure that we prevent the spread of the disease as much as possible. So our safety practices of wearing our mask, keeping our distance, washing our hands, that's all resulted in having a state where we have one of the lowest rates of individuals with the disease and one of the lowest rates of deaths. That's admirable. And I know there's been tremendous sacrifices by all of us to achieve that. Now, it is an exciting time. We have vaccinations coming to our island, and we are working as fast and hard as we can to get those vaccinations in all of us. It's very important to know that there is a prioritization of who gets the vaccine first. And I've so appreciated your patience. The most important to start with was our healthcare workers and essential workers, those who are there to take care of us if we are sick. And I'm happy to say at Queen's, we are well into finishing that series of vaccinations. We've opened up the number of individuals that the next wave that can come, and that's coming from the health department. And that includes more essential workers and our kapuna. And our kapuna, particularly individuals over 75, the reason that is so important is they have some of the worst healthcare outcomes if they have COVID. Now, we've opened up mass vaccination sites. Our wonderful partners at Hawaii Pacific Health started theirs about a week and a half ago. Queen's started ours just under a week ago, and they are incredibly important because our smaller sites, which we've been using for a good over 6 weeks, can have limitations in how many people we can vaccinate. So up to the time that we opened up our mass vaccination site, a big day for us at Queen's would be vaccinating 1,000 people. Now we have the capacity between our two sites to vaccinate 3,000 people a day. Now our goal is, and it will take a bit of time to work through all the processes, our goal is in mass vaccination sites to get between 3,000 and 5,000 people, but that will take a couple of weeks of working through all the processes to make sure they're safe and reliable. There are other sites called pods, and pods tend to be either pharmacies or hospitals where they are doing vaccinations, but on a smaller scale. So there are several pods throughout the islands. And as an example, one of our pods, which is our hospital in Molokai, has already given over 1,000 vaccinations, and its only limitation right now is getting vaccine to the site. They have been able to go through the 1A, 1B, and they're into starting their 1C list. So we'll move as fast as we humanly can based on the availability of the vaccines. Nationwide, there's been a problem with getting the vaccines. And I am very, very pleased with our President Biden, as he is doing everything he can to open up the production of vaccines and the distribution of vaccines. And our Department of Health, as quickly as they get those vaccines, they are pushing them out to us, which I truly appreciate. And I have real excitement about this week, as I think we're going to see more vaccines on island, which means more vaccines that we can give to you and get you safer. Well, it's a time of great hope. We need you to be vigilant and to continue to wear your mask and to continue to keep physical distancing. Even if you're vaccinated, those of us who are vaccinated need to continue to wear our masks, keep distance, and washing your hands. And we need to do that most likely for several months until, as a community, we can say we're at a point where we can reduce that activity. We're still learning as a country and as a world about the vaccinations. So think of vaccinations as that next layer of safety, but don't pull back on the basics. Together, we will be safe. Together, we will open up our economy. Together, we're going to be stronger. Continue your patience. Know those vaccines are coming. And I look forward to more conversations about the importance of vaccines. Mahalo. Stay well.